Hello everyone, you're watching PhysioClassroom channel, and in this video we are going to learn how to perform the acromioclavicular joint circumduction mobilization technique. A therapist can decide to utilize this treatment strategy to treat individuals who are suffering from conditions like frozen shoulder or acromioclavicular joint arthritis. So to perform the acromioclavicular joint circumduction mobilization technique, the therapist is going to make the patient lie down in supine lying position. The therapist is going to stand on the side that needs to be treated so that the therapist is facing the cephalad direction in an oblique manner. Now, with the patient's shoulder drawn closer to the edge of the couch, the therapist next takes the arm into slightly abducted position. Support is provided to the right-sided arm and forearm region by first flexing the right thigh and then placing it just posterior to the axillary region of the right shoulder. Now from here, the left hand of the therapist is going to be placed just behind the elbow joint to support the elbow in the extended position. And with the right hand, using the lumbrical grip, the therapist is going to hold the lateral end of the clavicle just medial to the acromioclavicular joint. Now from here, the therapist applies traction with the left hand so that the shoulder is actually distracted and also it gets elevated from the treatment couch. What this actually does is, this makes the clavicle more prominent and easily accessible for the right hand to have a firmer contact. Now, while maintaining this tractional force, the therapist next starts delivering the circumductory movements to the right shoulder joint by varying the amount of knee flexion and ankle plantar flexion in the right-sided lower limb. So what the therapist needs to ensure during this maneuver is that at no time the thigh should leave contact of the posterior axillary region of the shoulder joint, and also the tractional force is maintained throughout the circumduction maneuver. So once again, let's have a look at this technique. So I have both the contacts at their position, support with the thigh, and now from here I start delivering this circumduction movement while maintaining the distraction or traction with the left hand. Please note, if the technique is painful to the patient, then always prefer to place a towel roll or a soft cushion pad over the clavicle before starting with the mobilization session. So this was all about the practical demonstration of the acromioclavicular joint circumduction mobilization technique. See you all in our next video. Till then, keep learning, keep sharing, and stay connected.